In my opinion, the eye is the first part of your face to age. So it's something that you can tackle early on in the aging process, maybe in your 30s, early 40s, just by doing something simple like an upper blepharoplasty, which is just removal of some extra skin or fat from the upper eyelid, which I think is the biggest bang for your buck. It has very minimal downtime. It's a very easy surgery to recover from, the upper blepharoplasty. The lower blepharoplasty is a little more complicated surgically, but I think the results there are also fantastic. Kind of to top it all off, the brow lift is something that's an easy adjunct to tack onto either one of those operations. So when you present to me for a consultation, the first thing I'm going to do is make sure your brow is in a good position. Because sometimes people just come to me and say, I need an upper eyelid surgery, and I'm looking at it and I'm like, well, let's just take a step back and let's look at where your brow is sitting. Is your brow starting to fall, which is making it look like you have extra skin on your eyelid? Because if that's the situation, then a brow lift is probably a better operation for you. And sometimes you need both. You do a brow lift and an upper blepharoplasty at the same time to get maximal results. The lower eyelid, I think, goes really well with the facelift because the facelift is really your substrate or the building block at which the lower eyelid is sitting. If the rest of the face is in a good position, then doing a lower eyelid surgery is easy to do with low complication rate. But if the rest of your face is sagging and your eyelid is hanging down with the rest of your face, then we really need to lift the bottom part up first before we address, or at the same time as we address the lower eyelid. But it's important for your surgeon to evaluate the entire face when they come up with that surgical plan for you.